Hi, I'm Dr. Hirday Kapoor, consultant obstetrician gynecologist at Cloud9 Hospital, Punjabi Bagh. Today we'll be discussing about the role of folic acid in pregnancy.
What is folic acid? Vitamin B9 or folate or folacin is also known as folic acid. The active form of folic acid is 5-methyl tetrahydrofolate.
Folic acid is naturally found in spinach, broccoli, Brussels sprouts, green leafy vegetables, avocados, kidney beans, and oranges. The bioavailability of the naturally found folic acid is hardly 25 to 50%, that is, only 25 to 50% is absorbed in the body. There are certain foods which are fortified with folic acid, like the breakfast cereals, the breads, whole grains, certain juices. The bioavailability of this is as close to 85%, but usually the synthetic form of folic acid, those are the tablets, the bioavailability is as close to as 100%, that is, the absorption is as close to as 100%. Deficiency of folic acid causes anemia, extreme tiredness, lack of energy, may lead to mouth ulcers and muscle weakness, leading to fatigue all the time. It may also lead to psychological problems like depression, anxiety, dementia, and confusion. So what does folic acid do in the body? Folic acid is necessary for the DNA and the RNA formation. It metabolizes amino acids. It is necessary for the cell division and for the maturation of the blood cells and proper functioning of the brain and the nerves. So what is the role of folic acid during pregnancy? In the first trimester of pregnancy, the cells are dividing very fast. The DNA and the RNA is being formed, and due to which we need folic acid for the formation of DNA and RNA so that congenital defects can be avoided. The neural tube defects occur in case there is lack of folic acid. Now, what is neural tube? Neural tube is the precursor of the central nervous system. The central nervous system forming the brain and the spinal cord. Now, certain times what happens, the spinal cord, there is a lag or the spinal cord comes out, which is known as the spina bifida. Folic acid prevents the formation of spina bifida, where there is abnormality in the spine, and encephaly, where the brain is not completely formed, or there is protrusion of the brain matter known as encephalocele. It also prevents certain congenital heart diseases. Folic acid also prevents miscarriages, low birth weight babies, preterm labor, and complications associated with pregnancy like preeclampsia and diabetes. So now we'll be talking about the dosage of folic acid. So dosage for folic acid in a non-pregnant woman is 400 micrograms, and in a pregnant lady it may vary from 600 to 800 micrograms, but during pregnancy higher doses of folic acid is required. This is to prevent anemia, neural tube defects, and in women who are pregnant and suffering with epilepsy or lupus, SLE, or beta thalassemia, or they have had previous miscarriages due to neural tube defects or family history of neural tube defects. Folic acid is water soluble, thus the excess amount of folic acid is secreted by the urine. Can there be toxicity of folic acid or side effects of folic acid? Yes, when the person has a severe liver disease and is not able to metabolize folic acid in the body, the excess amount of folic acid may lead to formation of cancer or may cause heart attacks in a previously prone person with a heart disease, and may also inhibit the absorption of vitamin B12, causing anemia. So now we'll be talking about when to take folic acid. Folic acid should be taken in the preconceptional stage, that is, whenever you're planning pregnancy, at least 3 to 1 months in advance, you should start with folic acid. And if accidentally you discover that you're already pregnant, start your folic acid there and then only. As the cells are dividing and the DNA is being formed, organogenesis is taking place, so that there should be no neural tube defect that should occur in the baby. Now, if there is any woman who is pregnant and has beta thalassemia, she should take folic acid throughout the 9 months of her pregnancy. So finally, that we have learned everything about folic acid, my advice to you as your gynecologist would be to never miss out on your daily dose of folic acid, that is 5 milligrams every day, so that there are no neural tube defects, there is no anemia, and you give birth to a very healthy and a happy baby. This is Dr. Hirday Kapoor, See you guys in the next video with a new topic.